Imagine lying on a wooden table, wide awake. A surgeon drills into your skull without anesthesia. Welcome to ancient medicine, shocking, bizarre, and often painful. Today, we'll explore ancient medical practices that will leave you grateful for modern healthcare. Let's dive in. First, let's talk about trepanation. This is when a hole is drilled into the skull. Archaeologists found trepan skulls from 7,000 years ago across Europe, Africa, and South America. It was surprisingly common. Why did they do it? They believed evil spirits caused headaches and seizures. Their solution? Drill a hole to release them. Many skulls show signs of healing. This means some patients survived the procedure. No anesthesia. Just stone tools. Can you imagine that? Next on our list is bloodletting. For nearly 2,000 years, doctors believed that illness came from an imbalance of bodily fluids. If you had a fever or a headache, doctors would drain your blood. Leeches became popular for this purpose, slowly sucking blood. In severe cases, doctors sliced open veins. They thought too much blood was the problem. However, this often left patients weaker, and some believe excessive bloodletting may have led to the death of George Washington. Let's discuss mercury. This toxic metal was believed to grant immortality in ancient China. Emperors consumed it, hoping to live forever. Instead, many poisoned themselves. In Europe, mercury was used to treat syphilis. Patients inhaled mercury vapors or had ointments rubbed on them. The side effects: tooth loss, tremors, and insanity. Patients trusted their doctors while being prescribed poison. Now, let's talk about ancient dentistry. Tooth pain was unbearable, yet there were no numbing injections. Some cultures thought toothaches came from toothworms. To cure them, doctors burned them out with hot tools. Others applied acid directly to the nerve. Tooth extractions were done without anesthesia. It must have been terrifying. Moving on to ancient Rome, gladiators weren't only fighters, they were medical experiments. Roman doctors learned how to treat wounds due to the frequent injuries gladiators sustained. They stitched wounds and used honey as a disinfectant. However, they also created strange healing pastes from animal fat and plant ash. Some methods worked, while others were horrifying guesses. In medieval Europe, urine became a diagnostic tool. Physicians analyzed its color and smell to understand illness. Some even tasted it. Sweet urine indicated diabetes, an observation without scientific knowledge. Primitive? Yes. But it showed some understanding of health. Now, let's look at surgery before anesthesia. In the 1800s, there was no reliable way to block pain. Patients were given alcohol, opium, or bits of wood to bite on. It was all about speed. Surgeons often completed amputations in under 2 minutes. The faster they worked, the better the chances of survival. Infection levels were high. Mortality rates were terrifying, yet people volunteered for surgery. Ancient Egyptian physicians had advanced practices for their time. They kept records on papyrus scrolls. They treated fractures and performed minor surgeries. But they also mixed medicine with magic. Some treatments were ridiculous, like wearing amulets or applying moldy bread to wounds. Surprisingly, mold contains penicillin-like properties, so they stumbled onto something effective. Mental illness in ancient times wasn't seen as psychological, it was spiritual. People believed that conditions like epilepsy were caused by possession. Treatments ranged from herbal remedies to exorcisms. It often led to suffering, based on cultural beliefs. Without neuroscience or psychology, humanity sought to explain the unexplainable. Despite the horrors of ancient medicine, it laid the groundwork for modern healthcare. They observed symptoms and documented cases. Yes, many methods were painful, but progress demands trial and error. Ancient surgeons learned from battles. Healers handed down herbal wisdom. Cultures had a shared goal: finding answers, even when wrong. Before dismissing these ancient practices, remember, we owe our advancements to their courage. Imagine a future where someone looks back at our treatments and feels the same astonishment. History has a way of humbling us. Ancient medicine wasn't foolish. It was humanity's fight for survival with limited tools. Sometimes that meant sharp stones, sometimes it meant toxic metals. The goal behind every method was clear: survival. If this video made you appreciate modern medicine, share your thoughts in the comments. What ancient practice shocked you the most? If you had to survive one ancient treatment, what would it be? Don't forget to subscribe for more deep dives into the strange and dark chapters of history. The past is not just different, it's disturbingly fascinating. And there's much more to uncover.